gripping visuals that have sent shockwaves around the world. India is battling mightily to fight the pandemic. After China, it is the most populated country in the world. Over 240,000 people have succumbed to the deadly virus there. A staggering 22 million cases have been reported.
Oxygen is in short supply across that country, which actually produces quite a good number of that commodity. This slide shows you the crematoriums that are filled almost on hourly basis in India. It shows you how overwhelming this pandemic can if it takes us unawares. So why are we seeing what we are seeing in India? First of all, the number one lesson is that if we relax public health measures too soon, for example, we organize big religious gatherings, reopen most public places, and begin to crowd together during elections, we are inviting that same scenario into our countries or our continent. Second is the presence of the new variants. Thirdly, the possibility of reinfection because of loss of antibodies. So we are still dealing with a virus that we've learned a lot about, but we are still learning more about this virus. Let me just leave this page by citing this quote from an Indian colleague who says, COVID-19 had not gone anywhere and a tsunami would hit us if urgent actions were not taken. Sadly, a tsunami has indeed hit us now. End of quote.
The Africa CDC says African countries are now beginning to report cases of these variants.
23 countries have reported the B1351 variant. 22 countries have identified the B117 variant. And about 4 countries have now identified the B1617 variant. That is the variant that is predominating the pandemic in India.
South Africa will have to be vigilant.
Let us all be vigilant. Let us all be careful. It is really in our hands. In our society, less than 1% of the population has been vaccinated. So the vaccines are still not part of our fight in society. Nearly a third of the health workers have been vaccinated. So there's some protection in the front lines. But in the general population, to date, we do not have anything.
Our approach really is around understanding more about these particular viruses and the implications around transmissibility and vaccines. And our approach really is, in terms of our management, is how do we control transmission of these particular variants, as well as looking at our vaccine program. And that's going to be really key in terms of managing these particular variants as well.
The variant means the virus is evolving over time. However, scientists believe on the market, vaccines will not be rendered useless as they will still provide some protection against these new strains. The Minister of Health, Dr. Zweli Mkhize, has appealed for calm. He says officials are monitoring the situation. Sophie Mokoena, SABC News, Johannesburg.